Welcome back. This is me, Monica Sharma, and welcome to MS Bio Academy. And today we are going to talk about this very particular topic, which is what is point of care diagnostic. Now, this is a question which comes to the mind of each and everyone that what is this point of care diagnostic, and nowadays it is being very commonly used everywhere. You might be reading scientific paper also articles. There it is written that point of care diagnostic devices or the kits has been launched against COVID-19. So all these things are coming up to your mind that what does this point of care diagnostic means. So let's find out this point of care, or the in short we say POC diagnostic devices, or what is this POC diagnostic means. Now point of care, it might be coming to your mind simply that diagnostic means something which is able to diagnose any particular kind of a disease symptoms, or the kind of fluctuations or changes inside our body which is taking place, be it related to the glucose level, be it related to the electrolytes level, or anything, or virus infections, pathogens, right? So point of care means at that point where the care is required, that is just near to the patient. If that diagnosis is possible, that is called as a point of care diagnostic. Okay, so it obtained the diagnostic results while within the patient or close to the patient, and it can be used in either in the doctor's office, or it can be used in the hospitals and in the patient's homes itself, right? So that is what the point of care diagnostic is. It is near or close to the patient itself. All right, that is the point of care diagnostic main aim is. The POC diagnostic devices give the quick feedback on many sorts of medical tests. So POCT, that is POC testing, is to bring the test conveniently and immediately to the patient. That is the main aim of that POC, or the patient point of care diagnostic devices is. So this increases the likelihood that the patient, physician and the care team will receive the results quicker, which allows for the better immediate clinical management decisions to be made, right? Sometimes what happens is, in a normal scenario, we go to the hospitals, then we give the sample and the results come after some time, because the diagnosis takes some particular laboratory settings and all those procedures to be followed, then only we get the result. But by means of point of care diagnostic, we get the results within few minutes or the few seconds. So that is how the immediate results or the quick results we are getting. So we can get the better or the quick medical treatment, or the clinicians will be able to diagnose it, take the decisions quickly based on what kind of ailment and what kind of a treatment is to be given to the patient. So POCT devices are mainly used for the blood glucose testing, blood gas and electrolyte analysis, rapid coagulation testing, rapid cardiac marker diagnosis, drugs of abuse screening, urine strip, pregnancy testing. We use the POCT, right? We just get that strip and we test it at home. We can test it at home whether pregnant or not. Then hemoglobin diagnosis we can do, food pathogen screening we can do, even cholesterol screening we can do. And nowadays the recent one is the infectious disease testing, like COVID-19 rapid antigen test is also being done. I'll show you one image for this. So this is the one, the POCT testing device for the glucose identification, in which we just prick a finger and take a blood out of it, and we just measure. This gives the reading of our blood glucose. Similarly, this is for the cholesterol, and then this is the COVID-19 test, the antigen test, rapid antigen test, which I'm talking about. This is just a simple strip like of a thing similar to the pregnancy strip, and we can just detect whether we are positive for COVID-19 or not. Even one more, this is being launched for the COVID-19 only. This is also for the rapid testing, in which is based on the smartphones also for detection. If you need to know more about this particular kit, I have posted a video on this based on the 15 minutes rapid testing by means of a saliva, because here we are using the saliva as a sample. We don't need any nasal swab, we don't need any blood pricking. So this is quite very going to be very quite effectively used at home, right? So this is one of the POCT point of care testing devices. Now advantages, if I talk about advantages, is it will reduce the therapeutic TAT means turnaround time. It is going to reduce. What is the turnaround time? Turnaround time means duration between the collection of the sample and the results which we are getting. So that duration is being reduced because we are doing it at our home only. There is no collection of samples happening here, so we will get the quick result. Then rapid data availability, obviously we are getting the results quickly. Shorter door to clinical decision time. Reduce pre and post analytical testing errors. Why? Because since there is only one sample is involved, we are only going to test ourselves. So one sample involved, so no cross contamination can happen due to multiple of samples. So there is no pre analytical testing errors, and the post analytical testing errors is also not possible because we are doing it by means of simple devices which are easy to handle, user friendly, and we can do it at our home. So avoid all those errors also, and only the small sample is required in this, so we don't need to give the 5 ml of blood for the sampling purpose. We can do it with microliters of the blood only. What are the disadvantages is that obviously since it is a portable device, so little bit of cost is high in this, so it is quite expensive. Then it is a operator dependent quality of testing, so can sometimes get the wrong results.